This is Radio Health Journal. I'm Nancy Benson. This week, people who need a kidney transplant but have a sensitive immune system.
They end up spending a much longer period of time on a transplant wait list, may never get off the transplant wait list, or may die waiting for a transplant.
Opening the door for kidney transplants when Radio Health Journal returns.
Summer wouldn't be complete without blockbuster movies and the concession stand snacks that go with them. But a panel of experts from the American Academy of Cosmetic Dentistry says those sugary, sticky, butter-laden snacks play a big role in tooth damage. Dr. Chian Gibson, president of the AACD, explains why.
Crunching down on an unpopped popcorn kernel is a common cause of broken teeth. And who hasn't had a popcorn husk lodged between back teeth and gums? That can easily get infected. Sour candies are high in acids, which cause damage to tooth enamel. And caramels are super sticky, so they remain on teeth and may pull out crowns or fillings. And soda, it's high in sugar and nearly as acidic as battery acid.
The expert panel says you don't have to avoid movie candy and snacks altogether. They suggest dark chocolate, pixie sticks, or nachos. And be sure to rinse your mouth with a glass of water after indulging in sweets. Find out more about caring for your smile from the American Academy of Cosmetic Dentistry. Visit yoursmilebecomesyou.com. That's yoursmilebecomesyou.com.
Kidney disease is extremely common. According to the National Kidney Foundation, about 26 million Americans have kidney disease, and more than 455,000 are on dialysis due to kidney failure. The waiting list for a kidney transplant is long, about 100,000 people in the U.S., and it takes years to get to the top, according to Dr. Jeffrey Burns, a nephrologist and professor of medicine and pediatrics at the University of Pennsylvania Perelman School of Medicine.
The wait list typically would be in the range of about 5 to 6 years. It depends on blood type, degree of sensitization, but it doesn't happen quickly, obviously.
Burns says that fewer than 17,000 Americans get a new kidney each year. The supply of organs is what usually limits transplants. But a kidney donor and recipient also have to be matched for compatibility, according to Dr. Roy Bloom, professor of medicine and director of the kidney transplant program at the University of Pennsylvania.
There are two ways that we look at compatibility. One is that the blood type has to be the same or acceptable, and the second being that there has to be a compatible match of tissue antigens.
Burns says there are several ways those antigens might be amped up to make a recipient more sensitive to a transplant.
The typical scenario is somebody who's had blood transfusions in the past may be exposed to somebody else's HLA antigens or HLA proteins and make antibodies against them. Another scenario that's common is pregnancy. So during a pregnancy, the woman would be exposed to antigens or proteins that the fetus has that she doesn't, and may develop an antibody response to those. And another is somebody who's had one kidney transplant or organ transplant and maybe needs another. And the importance of this for kidney transplantation is that those antibodies may then be directed against certain protein molecules in the donor kidney, whether that's coming from a living donor or a deceased donor, and cause an acute antibody-mediated rejection of that transplant. So it's very important in preparing for a transplant that the recipient not have antibodies that are going to react in an adverse way.
Many recipients have a mild reaction, and that can usually be managed. But some recipients are so sensitive that their immune systems will reject virtually any new kidney.
Most people who are on the wait list will be able to get a transplant, whether it's from a living donor or from a deceased donor. But there's about, I believe the number is about 15 to 20% of people who are on the wait list who have some degree of sensitization that's going to make it more difficult for them to get a transplant. And of those that are sensitized, most have a relatively modest degree, but some are very highly sensitized, which makes it very unlikely that they will be able to get a donor. It doesn't make it impossible, but it makes it that much less likely. So they end up spending a much longer period of time on transplant wait list may never get off the transplant wait list or may die waiting for a transplant, remaining on dialysis.
However, some of those patients may now be able to get a kidney thanks to a desensitization process described in a study in the New England Journal of Medicine. The study shows that filtering the antibodies out of the blood, then waiting for new antibodies to form, results in an immune system with a much lower risk of rejecting a new kidney.
With desensitization, as it's called, for either potential living donor recipients or for people waiting for a deceased donor but who are highly sensitized, there is this other alternative of undergoing a desensitization process and potentially making an individual patient more likely to be able to receive either a living kidney or a deceased donor kidney. It's not for everybody. It's expensive. It's not an approved indication, if you will, so there's some reimbursement issues, and there are some risks associated with it as well. But in the right hands, at the right institution, at a place that is committed to this and believes that it's the right thing to do, it seems to me that this may be an alternative for the highly motivated patient who is highly sensitized.
Desensitization costs about $30,000, but that's less than half the annual cost of dialysis. And if a transplant can be performed where it couldn't be done before, it also results in a much better quality of life. But Bloom warns that desensitization isn't for everyone.
The reality is not all patients, even using current therapies, not all patients can be successfully desensitized. Why this is important is because desensitization involves administration of generally very potent medications prior to the transplant to weaken the immune system of the recipient to somehow allow the donor that they would otherwise react against to successfully donate an organ to that recipient. So can it be done? Absolutely, and I think that the study bears that out. But number one, it can only be done in some people. We know from data that's been published elsewhere that some patients' immune system may be so reactive against an individual donor that no matter how heavy-handed you are with the immune-suppressing treatment beforehand, you just cannot eliminate that reactivity.
Bloom says some patients receive desensitization therapy but don't respond well enough for a transplant, leaving them with a weakened immune system and still on dialysis.
Do we increase the risk for them of further bad outcomes? Like, do we increase their risk of dying? Do we increase their risk of getting potentially lethal infections? And we just don't know that.
Over the past few years, another alternative has been developing, giving mismatched donors and recipients an opportunity. Burns says it's called a paired kidney exchange.
Let's say somebody is willing to donate to me but is immunologically incompatible, but they nonetheless say they're willing to donate. So there may be somebody else out there who is in need of a transplant and has a willing donor who's also immunologically incompatible with them but is immunologically compatible with me. And if my potential donor is immunologically compatible with that person, then we can just do a swap. It gets much more complicated because there may be multiple pairs of donors and recipients that are lined up in order to accomplish all of the successful matches that go into that swap. And there are organizations that facilitate these swaps. The bigger the swap, if you will, the more complicated it gets because you need multiple operating rooms, multiple surgical teams. You need to be able to get organs from place to place if necessary.
One other development since late 2014 is a change in the kidney allocation system. People who are highly sensitized are now given higher priority on the waiting list, so they have a better chance of getting a kidney that matches the narrow range they can accept. You can find out more about all of our guests on our website, radiohealthjournal.net. Our production director is Sean Waldron. I'm Nancy Benson.
Radio Health Journal returns with medical notes in just a moment.
When it comes to health insurance, understanding what you'll pay for covered services, prescriptions, and supplies is important, especially if you have a chronic condition like diabetes. Now, there's a new tool to help people with diabetes save money on test strips. Know My Copay is a website and nationwide telephone service that tells you the lowest copays for the top 5 brands of diabetes test strips in the market based on your individual health plan. Here's consumer advocate and nationally syndicated columnist Jim Miller.
Figuring out health coverage can be confusing. Know My Copay is a valuable free service that can help people maximize their healthcare dollar. By comparing the out-of-pocket cost of the various diabetes test strips available, people can make educated decisions about the products they use.
Know My Copay is sponsored by LifeScan, maker of One Touch brand blood glucose monitoring systems. Find the lowest copay for your test strips at knowmycopay.com or by calling toll-free 1-844-807-8936. That's knowmycopay.com.
Medical notes this week. High schools and colleges are keeping athletes with concussions out of competition much longer these days, but they may also need a break from classes. A study in the American Journal of Public Health shows that many student athletes who go back to class within a week of a concussion struggle with academic work. Researchers say academic problems are nearly 10% higher for those who've had a head injury, so easing them back to class slowly is probably a good course. Estrogen apparently plays an important role in the production of seizures in both men and women. Researchers say in the journal eLife that they were surprised to find that seizures stimulate the production of estrogen in the brains of mice, but when the production of estrogen was blocked at the start of a seizure, the attack was strongly suppressed. It could result in a targeted treatment without the side effects of current therapies, such as drowsiness or dizziness. Stress in early childhood may make the brain grow up too fast. A study in the journal Hormones and Behavior documented changes in the brains of mouse pups whose mothers were not provided adequate nesting materials for just a week. Researchers say stressed brains matured much earlier than those in a control group, but with reduced eventual growth. Scientists believe it's an evolutionary response to stressors, telling the body that life's too short. And finally, if you want to protect your heart, have a little chocolate every day. A study in the British Journal of Nutrition finds that people eating roughly one chocolate bar per day have reduced insulin resistance and improved liver enzymes. Researchers say the evidence is piling up, so someday cocoa-based products may even be recommended to improve cardiovascular health. And that's Medical Notes this week. More in a moment.
Do you know CPR? More than 350,000 Americans a year suffer an out-of-hospital cardiac arrest, and 90% of them die, often because bystanders don't know CPR. Hands-only CPR, without mouth-to-mouth breaths, is easy to learn and can double or triple the chances of survival. College student Matt Lickenbrock learned it at a CPR training airport kiosk.
2 days later on campus, another student was hit by lightning virtually in front of me. I was thinking, what did I learn at the airport? First, call 911, then push hard and fast in the center of the chest to the beat of Staying Alive.
You never know when you can save a life. The American Heart Association and the Anthem Foundation sponsor airport kiosks where you can learn hands-only CPR. You'll find kiosks at 6 major airports across the country, or take 1 minute and learn this life-saving skill online during CPR and AED Awareness Week, June 1st through 7th. Go to heart.org/hands-only-CPR. That's heart.org/hands-only-CPR.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.